We've all heard the saying that sticks and stones can break my bones, but words will never hurt me. Not true. Abuse comes in a lot of different forms, particularly in childhood. We can have physical abuse from beating or physical traumas of different kinds, some of which can be from accidents. We can have emotional abuse, where a lot of things like belittling and denigrating and terrorizing and exploiting, or maybe isolating a child or putting them through problems that go with a divorce, all can do a lot. And of course, there's even spiritual abuse. There are all kinds of things that have to do with rituals that have been really a problem. And of course, sexual abuse is there, much more common than we thought. It may be as much as 25% of our children are actually abused, perhaps even more of that, in some way or another. Finally, after 25 years of acknowledging that this is a problem, the American Academy of Pediatrics published an article in the journal called Pediatrics that talks about how important psychological, emotional abuse is, particularly when it's combined with things like physical abuse and sexual abuse. It shouldn't really be a surprise, because I know in my practice, I pay tremendous attention to that. I find that a lot of the problems that people have later in life are related to the way they learn to deal with situations as a child. The child feels loved and important and cherished and is comfortable and can be truly authentic. Then opportunities open and doors open and people seem to do pretty well. But that shy, reserved child, it's afraid to speak, it's worried about what people are going to think about them, gets their praises mostly from the outside than the inside, often wind up in my office with things like ulcers, headaches, backaches, all kinds of endocrine problems, can't sleep right, full of a lot of stresses. It can become really challenging. And my job becomes not just to treat the symptoms, not just the symptoms that people are having that were induced by these kinds of stresses, but to go back to the underlying cause and do something about that. And that's why we've created something called a healing circle, where we'll take those patients who are having a hard time getting well, where the medications or the technologies or the approaches that we take that are psychological just don't seem to work well. And in that setting, we'll often bring together 4, 5, or 6 practitioners for a couple of hours, usually 2 hours, record the session, and do 2 things. We listen and we care. And we don't charge for the time. It's a totally free experience for the patient. This often gets down to some of those things that happen to people when they're young, that they learn from the role models that are not healthy, and then they wind up with these situations later in life where they have the symptoms we just discussed. This leads often to people who are psychopaths or people who are thieves or doing things to get themselves into trouble with the law. There's a lot of physical violence in families that are like this. There are often family conflicts, there are divorces, sometimes there's mental disease or even drugs that are involved. This is the kind of thing where kids are defenseless. They have no way of coping with these challenges they're faced with because they simply don't have the tools to deal with them. And they repress what they can't solve. So the problems stay there and they fester. And sometimes somebody might be 60 or 70 years old before they make it to my office, and we're talking about what happened in childhood and how that's affected the way they value themselves and how they struggle through the challenges they face in life. So what we try to do is teach these people what they can do about the feelings that come up that lead them to have the kinds of behaviors that they have that aren't making for good health. So we do that in 2 ways. One is with psychological approaches. Good therapy can be very effective, but so many people go through this, and what they wind up with is knowing all their problems and not really having the experiential opportunity to feel what happened when they were a child, and they wind up stuck in their head. They don't use the tools that they have today that they didn't have when they were a child because they're afraid. In those settings, we do something called somatic experiencing, or something that's related to psychological approaches to body work, called body-mind psychotherapy. And that works very effectively a lot of the time because our muscles hold all that information that we ever experienced in our life, and we have a unique muscle tension pattern that no one else has. When you release those muscle tension patterns, often what happens is the old memories come back and we feel and experience them. When that happens, as we work through that feeling, realizing that we can never be hurt again by that situation because it's over and done with and we're not any longer a defenseless child, we have a way to deal with these problems in a very smart way. And that's what we guide them through very gently. And when people learn that they can deal with these situations because now they have tools, they don't have the same fear, and little by little they conquer them. We find that there's a large percent of the population that has this. It's much underestimated, and it is, in my opinion, a form of post-traumatic stress syndrome. So sticks and bones can break my bones, indeed. Words can be even more devastating, and if we realize that and we do the therapies that are possible, we can get past that. We can get well in every way.